A vasectomy is typically done usually through one or two small openings in the skin. Generally speaking, a vasectomy is done with either removal of a segment of the vas tube and a combination of either clipping the vas tube, cauterizing the vas tube, or tying the vas tube in some form of combination. There are techniques that don't involve incising or excising the vas tube, and those usually involve cauterizing a long segment of the vas tube. So after a vasectomy, men should realize that they are still going to be fertile. As I say, sperm really likes to hang out in our ejaculatory system and the urinary system for up to 3 months. So it's really important to follow the instructions from your urologist. And typically, most of my patients will perform a semen analysis at about the 3-month mark, which is about the life cycle of sperm and about the time that sperm can actually hang out in the ejaculatory system. So in general, when you have a vasectomy, we're simply cutting off the pipeline from the testicles to the ejaculatory system. This means that sex really should not feel any different after this procedure. It means that your semen volume should be about the same. So your ejaculate volume should be about the same. It should look just about the same. Orgasms or climax should not be affected by a vasectomy. And ultimately, your erections should also not be affected by a vasectomy. In general, as you're preparing for a vasectomy, there are no major restrictions on what you can or cannot do before. Some doctors do prefer that you avoid certain medications, such as ibuprofen. If you are taking blood thinners like aspirin, Plavix, or other blood thinners such as Eliquis or Xarelto or Coumadin, those certainly need to be stopped before your vasectomy. And there's a certain time frame that you must use in order to stop those medications. So I would ask that you consult your physician if you are on any blood thinners. I get asked very commonly, what is a good time to have a vasectomy? The truth is, any time is a good time when you feel like it is the right time to have a permanent procedure for contraception. However, a lot of my young patients prefer a special time in the year called March Madness. It means that they have a wonderful excuse to be a couch potato for 4 to 5 days straight and watch basketball games after their vasectomy. So March really tends to be a very busy time for a lot of urologists to perform vasectomies. But in reality, any time is a good time and a good excuse to have a few days off and be off your feet and away from chores.